Hey guys, I wanted to make this little improvised video. Actually, it's an internal video for my course students, but I thought that the impact might be very big if I publish it on YouTube. So this is a little internal video made public. Why? Basically because I hear some of my students tell me about gastric or peptic ulcers as a big problem. And they try to follow the doctor's advice to use proton pump inhibitors to diminish acid levels in the stomach. So basically, the doctor said that the problem is because of increased acid levels in the stomach, and we have proton pump inhibitors drugs and other disruptor drugs of production of HCl, which is hydrochloric acid, in the stomach to diminish stomach acidity. There's several misunderstandings here. The first one, stomach acidity cannot be too high. It can only be too low. This is an axiom because the highest acidity is the lowest pH. The lower acidity, higher pH. We need to remember that. When doctors said that we need to change the high acidity, it's a big fault. The problem is very, very different. That's the first paradox we need to understand. The second paradox said that when we have gastric or peptic ulcers, it's the diet or lifestyle are never the cause. I want to quote here. Peptic ulcer disease is a break in the inner lining of the stomach, the first part of the small intestine, or sometimes the lower esophagus. It basically shows that the problem is not a single problem, but it's a systemic problem. This is very crucial to understand. When we have changed acidity and inflammation, it influences the whole area, not only the ulcer. An ulcer in the stomach is called a gastric ulcer, while one of the first part of the intestine is a duodenal ulcer. The most common symptoms is upper abdominal pain at night when people wake up, and also abdominal pain that sometimes improves with eating. With a gastric ulcer, the pain may worsen with eating. Described as a burning or dull ache. Some can be other symptoms, sometimes belching, vomiting, weight loss, poor appetite. And in 15% of the cases, bleeding can occur. Common causes include the bacteria, and here the doctors are talking about the causes. And the causes are Helicobacter pylori and non-steroidal anti-inflammatory drugs. Also can tobacco smoking and stress as a result of other serious health condition. Also Crohn's disease. Then the diagnosis is usually suspected due to the symptoms with confirmation by either endoscopy or barium swallow. Both are highly invasive procedures that can make it yet worse. And then you can test for Helicobacter pylori by testing the blood for antibodies, a urea, breath test, and a biopsy of the stomach. Okay. And then a phrase, diet does not play an important role in either causing or preventing ulcers. That's a second paradox of somehow a paradox, some maybe a fault or a breach in understanding, and I will tell you guys why. So the treatment includes stopping smoking, stopping use of NSAIDs, and taking medications to decrease stomach acid. The medication used to increase acid is usually either a proton pump inhibitor, PPI, or an H2 blocker, with 4 weeks of treatment initially recommended. Ulcers due to Helicobacter pylori are treated with a combination of medications such as amoxicillin, clarithromycin, all of them antibiotica, and a PPI. Antibiotic resistance is increasing, and thus treatment may not always be effective. Bleeding ulcers may be treated by endoscopy and open surgery. Okay, let's stop with that. People have, this is some fallacy here that needs to be talked about. Okay, the biggest problem is that proton pump inhibitors, when they diminish the acidity of the stomach, they disrupt many different, well, basically life-giving functions in the body. And we have to see what is the cause and what is the effect. The cause of Helicobacter pylori making a lesion in the stomach wall, it's because Helicobacter pylori, it's not normal for Helicobacter pylori to thrive in an environment with a high acidity. It's impossible. Helicobacter pylori can only thrive in an environment with low acidity, with high pH, low acidity. That's the same. So what causes low acidity? And basically what we call small intestine bacterial overgrowth, it's a part of it. It's the same area. A dysfunction of lower esophageal sphincter with belching, and you also take proton pump inhibitors against that. It's the same area. It's an inflammation in the same area. You see esophagus here, stomach here, and small intestine there. It's the same area. Inflammation in the same area. Dysbacteriosis in the same area. So we need to understand that pH regulation is a central function in the body, and pH is basically regulated by breathing, and breathing is regulated by our perception of stress, not the stress itself, but our perception of stress. So when we start working, changing our perception of stress, having psychophysiological means or instruments are working with that. Psychophysiological is very crucial, because physiology is much more like ingrained in our body, and we can learn some tools that makes us stronger if we connect not only psychology but physiology with psychology. Those are psychophysiological tools. We connect it with breathing, then we normalize a function of the stomach, because the cells that are producing HCl in the stomach, they are highly influenced and controlled by breathing and by the amounts of oxygen and by normal oxygenation. Next part of something that doctors mean that don't have influence to stomach ulcers is your nutrition. If you eat sugars, if you digest sugars as a main pathway to get energy from, well, you will start having dysbiosis with time, especially in the post-reproductive age, because in reproductive age until 35 you have normally good health, because you have natural health. Nature cares about you. That's evolutionary, from evolutionary perspective. After 35, you need to care about your health, because health is not natural anymore. So we start getting disruptions, because if you start having changing pH in your stomach, because you don't need high pH, you digest mainly plant matter. So basically you don't need high acidity for that. So normal high acidity of around 1.8 to 2 pH, it's changing, slowly changing to 3 to 4, and then you have a major disruption already, which allows Helicobacter pylori to thrive in the in the environment of your stomach, and it goes up and goes down, causing heartburn and disruption of this gastroesophageal sphincter, lower gastroesophageal sphincter here, and a disruption of another sphincter that connects your stomach with small intestine. And then you have overgrowth going both directions, and your problem becomes bigger and bigger. Okay, and another thing, when pH goes abnormal in the stomach, goes up, the acidity goes down, what happens? The bioavailability of vitamins and minerals is heavily disrupted. All of them, because it depends on normal acidity of the stomach. And then we can get problems because of blocking of B12 absorption, mainly because we don't have normal sources of B12 when we're eating plant matter, because it's not found naturally in plants, only in animal foods. And then if you're eating a little bit of animal foods together with plants, it can be basically the availability of it can be disrupted because of low HCl. The ability of calcium is bioavailability of calcium disrupted, and so on and so on. So what I'm saying is, if you guys decided to do something with your health, to do something with your gastrointestinal problems and with gastric or peptic ulcers, it's very crucial to understand that you need to understand the paradox of medical world, treating your symptoms with things like proton pump inhibitors, PPI, to disrupt your normal gastric acid production yet more, but removing the symptoms. So people feel that, okay, when they take proton pump inhibitors, they are removing the symptoms. Well, yes, you maybe it can burn less. It can actually, the symptoms can be lower for the time, but you will have much bigger problems in the near future. And this is very crucial to understand. So you have to understand the physiological background, and you have to work with answering the question, why are you doing this? If you are seriously connected with the inspiration that I'm giving you, then you have to understand and basically implement it into your life. Get off sugar, get off plant matter, eat meat, preferably the raw, more raw the better, because we need less less ferments, less enzymes to digest meat, because there are living ferments and enzymes in raw meat, and they are not disintegrated, they are not denaturated. The protein is not denaturated. Denaturated protein which is fried or have treated with heat more than 85 degrees, is already denatured, and it's very, very hard to digest. So all of those aspects are crucial. Not drinking water with your meals is crucial. You have to take it seriously, and you have to take it basically as I advise you guys, because we can only reverse to normal state of health if we are connecting the dots together, of breathing, of nutrition, of understanding the rules of eating. We have from 7 to 10 different rules of eating that are not only about food we're eating, but how we're eating it. Not drinking water before and after 1.5 hours after is very, very crucial. So that's it. And if you are not ready to do that, and you say yes to proton pump inhibitors, and if you say yes to high glucose foods, then you may use my program as a tool of like pure interest and understanding maybe, but you are not ready to implement it maybe, because this is a very, very crucial part. It's a very crucial part of it. If you are on this program and you are disrupting the healing process by taking proton pump inhibitors and not using natural means, basically there are some natural possibilities that we have, and natural possibilities is, for example, sea buckthorn. I can tell you that there's possibilities of supplementing with sea buckthorn oil 3 times a day to heal some gastric ulcers during 2 weeks, and you will not need to disrupt the whole gastrointestinal physiology to do it. Okay, but it requires inquisitiveness from your side, and really a big decision of understanding whether or not you want to diminish the symptoms or remove the symptoms short term, or you want to heal long term. Because the advice from the standard of care, from medical advice about taking proton pump inhibitors, it's only about removing symptoms. It's not about healing the whole gastrointestinal system, which you can do basically only by connecting the dots of lifestyle change with exercise. And when I say lifestyle change with exercise, we say effective breathing first, effective nutrition, understanding of a resilience, from mental resilience, where it's your perception of environment that makes a difference, different balance, a normal balance between sympathetic and parasympathetic, which is physical and immune resilience, basically. That's we call allostatic resilience triangle. So yes, it's a little rant that I wanted to make available for you guys, just to remind you that in order to heal in post-reproductive age after 35, well, basically before is the same thing, you need to take a serious decision of working long-term, working not just removing the symptoms, because it will never lead to healing. By the way, if some of you knows about the examples of healing, with the proton pump inhibitors, long-term healing of small intestine bacterial overgrowth, of the dysfunction of gastroesophageal sphincter, and also bacterial overgrowth, bacterial dysbiosis in the lower areas of your gut. Let me know. Enlighten me. I never heard about that yet. Okay? So, best of healing to you guys. And remember to ask the question, why often? Because when I work with people that have third or fourth stage of cancer, they really understand my message, because their window of opportunity is not so broad. It's not so wide. So they really understand that often have not much time to do things. So they are kind of forced to understand that if they want to live and thrive and reverse to normal health, they need to act now. That there will never be better time to act than now. And it's not about only about cancer. It's about all kind of lifestyle diseases, because lifestyle disease is possible to reverse only when you are 100% dedicated. You really decided 100% to do something about it. The cures that remove symptoms will not help you. You will only be able to cure yourself by applying the integrative knowledge about human physiology. And that's what we are doing on my program. So please remember that. Be strong, be aware, look at yourself in the mirror, acknowledge that you can take action, love yourself, and you will succeed. Love you guys.